And we are back. I'm talking to you guys some more today about COVID-19. And I just wanted to provide some clarification surrounding two drugs that have been circulating around the internet. Ever since President Trump reported the breaking news that there was groundbreaking treatment for COVID-19, the internet pretty much broke, and doctors have been getting floods of phone calls and requests to get prescriptions for these medications. So as you all know, the two medications are azithromycin, which is more commonly known as a Z-Pak, and hydroxychloroquine or chloroquine, which are anti-malarial medications, but also used in the treatment of autoimmune conditions such as rheumatoid arthritis. So the claims of these medications came out initially because there was a very, very tiny study conducted in France with 22 people who had COVID-19. And they said that this combination of drugs might decrease the duration of COVID-19. Might. Keyword is might. So basically, there was no clinical evidence to support that these medications even help with the treatment of COVID-19. It's not evidence-based. There's no clinical trials to support it. So I just want the public and people to know that azithromycin and chloroquine or hydroxychloroquine are not used as definitive treatments against COVID-19. Nor are they used as prophylaxis against the virus. Taking them or keeping them on hand is actually quite dangerous. It's not safe for a patient to request that from a doctor. There's no indication that you should be on either or of those medications, and they come with major side effects. So, for example, chloroquine, hydroxychloroquine are also known as Plaquenil. I prescribe it in my clinic for patients who require it for certain diseases that they have. But many times, these patients experience awful, terrible side effects. You don't know what medications that the drug might interact with, and the side effects can be very serious. So one of the side effects can be, but not limited to, cardiac toxicity. Yes, if your medication interacts with a chloroquine or hydroxychloroquine, it can lead to death very easily and very quickly with these medications. So these meds are not to be taken lightly. They're not candy. You should not just keep them on hand in case you get coronavirus. If you get coronavirus, if you're sick for more than 3 to 4 days, then call your doctor and see what the next steps are. But the word I want to get out there is that, there is no effective treatment for COVID-19 at this point. There are no drugs that have been clinically tested. There's no evidence to back this or to support the fact that azithromycin and chloroquine can be used safely at this point. And really the only prevention for contracting the virus is social isolation. Hopefully what everyone has been doing for the past 2-3 weeks. So I just want to kind of get that clear and out of the way. And guys, please do not text or call or message your doctors asking to get this medication prescribed because it probably more likely than not will not happen. It's not safe. Just be safe out there. Socially isolate yourselves. And if you have particular questions regarding this video or anything else, feel free to DM me. Stay safe, guys.